Today's Imprint Weekly podcast is brought to you by Accenture. Change is afoot in child welfare. Change that means agencies focus on results for children and keep far more of them safe at home with their own families. Accenture's child welfare team is leading the way in the effort to ensure technology does its part in that success story. Accenture offers cutting-edge case management tools that ensure agencies can see insights that drive decision-making and caseworkers have information they need at their fingertips. Together, these tools help agencies stay laser-focused, reinventing child welfare into a source of strength for families when they need it. For more information, visit www.accenture.com/child-welfare.
Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of The Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at @TheImprintNews. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business, policy, and practice. No guest today. You are stuck with me. I'm also recording not from our little podcast studio in my basement, so apologies if the sound is not up to our usual par, although I'm sure by the time you get it, our wizard of producing and editing, Christina Joko, has made it almost as good, if not equal, to the usual. It's been a while since we did news around the country, so let's use this episode to get caught up on stuff, and then we'll get back to kind of regular order on the podcast next week, I hope. After taking testimony from adoptees living in the United States and Europe, the South Korea Truth and Reconciliation Commission is launching an investigation into dozens of cases involving children who may have been wrongfully removed from their families, according to reporting from the Associated Press. There may be hundreds of cases to examine among South Koreans separated from their birth families as kids, who, according to AP, comprise the world's largest diaspora of adoptees. Now, this is the second big move by a country to own up to questionable practices of the past when it comes to adoption, in particular international adoption here. In 2022, last year, Ireland launched an online service that for the first time promised adopted people born in Ireland, wherever they live now, the right to see any information that the state holds about them, including the names of their birth mothers. And in Ireland, that came several years after the Irish government had apologized for adoption practices that robbed children of their identities, their heritage. The apology came on the heels of an investigation that confirmed what many knew to be true, and that is that while pressuring unwed mothers living in maternity homes, often church-led maternity homes, to give their babies away, officials in Ireland frequently changed birth certificates to make it appear that adoptive parents were the birth ones. So perhaps we'll see a similar development in South Korea as they begin kind of a road that may lead to something like Ireland. I think this is probably coming for a lot of countries, including our own here in the United States, where we have seen, through the Amara Project out of Washington, a concerted effort to do at least better by the many people who have sought information about their history as adopted people. Every year when the federal government produces a report on child maltreatment, it includes a set of relevant definitions in the glossary at the end of that report, which usually ends up hundreds of pages after all the data that they release. Here is how those reports have defined neglect since the year 2001. A type of maltreatment that refers to the failure by the caregiver to provide needed, age-appropriate care, although financially able to do so, or offered financial or other means to do so. And yet, research of state policies show that when it comes to state policies on neglect, most of them will justify removal for lack of housing only, and almost half of states do not specifically exempt a family's financial ability to provide for their child. Now, the Biden administration is going to make a single grant of between $5 and $10 million over a 5-year period to a group that will be tasked with helping states to develop best practices and policies to differentiate poverty from willful neglect. So basically what it comes down to is this definition that the Biden administration has seized on in federal language really, to some extent, just that language exempts the conflation of purely poverty as a driving motivator for neglect charges and investigation. Now, that federal definition is not a part of any federal law. It appears, I kind of went down a rabbit hole, it first appeared as the definition that was developed in the early 2000s for this report, for this child maltreatment report. But there's never really been a specific definition of neglect or abuse or anything that's been kind of foisted on the states from the federal government. And it looks like what the Biden administration is trying to do here is to sort of capture this language in federal code or whatever you want to say, and, work with one partner to see what different states have done proactively to exclude families from being caught up in the child welfare system solely because of poverty, which I think most people would agree is the case when you are removing a child or involving a family in a child welfare case purely because they do not have adequate housing. I'm just going to quote from the grant notice here in the explanation that they give for this. There's been a growing national awareness and interest in encouraging mandated reporters to become mandated supporters. This funding will support building a national messaging campaign on how individuals can become a source of support to families in their community by acknowledging the impact of racial inequities and seeking solutions that can help mitigate child safety concerns before they rise to the level of crisis. And I think it's worth pointing out that the term they use in here, the movement from mandated reporters to mandated supporters, comes out of New York City. The phrase was definitely coined by Joyce McMillan, who's the founder of JMAC for Families. This fall, you might remember we had Kate Fort on the podcast to talk about the Brackeen v. Holland case that the Supreme Court heard arguments on in November. Kate is one of the foremost experts on the Indian Child Welfare Act, and this is a case that could strike down in part or in whole the Indian Child Welfare Act, better known as ICWA. So during that conversation, Fort mentioned that she had really come around on the idea of state ICWA laws, right, that codify some or all of the federal protections on a state level, which at first made her a little wary. Are these going to bump up against federal ICWA regulations or kind of make it seem less important? But because the federal law is so spottily enforced, frankly, she said they've become an important complement to the federal law that was passed in the 1970s. Well, she doesn't seem to be the only one who feels that way, because a slew of states have bills in the pipeline to bring ICWA down to the state level this year, or have done so in the lead up to the arguments. So far this year already, Nevada, North Dakota, and Wyoming all have seen bills enter the mix for this legislative session that would import the Indian Child Welfare Act to the state level. So if those become law, they would join 11 other states that have codified ICWA. Those are Alaska, California, Oregon, Washington, Iowa, Minnesota, Michigan, Nebraska, New Mexico, Wisconsin, and Oklahoma. And of that list, Alaska and New Mexico basically codified ICWA in 2022. It's also worth noting that Arizona, I think, has a pretty strong memorandum of understanding with its tribal partners within the state. So assuming that stayed in place after ICWA was struck down, if that is something that happens, that MOU would offer at least some of the protection of the federal law. So those states that already have a state level ICWA law covers 82% of the federally recognized tribes in the United States. There's something like 547 tribes that are recognized federally, and 82% of them are based within the state borders of those states with ICWA laws. Wyoming has 2 tribes that are federally recognized. Nevada has 17, and North Dakota has 4. So if all 3 of them passed the state level ICWA law, we would be up to about 86% of federally recognized tribes being based in states that have the state level protection. So some of those states with lots of recognized tribes that would still be without a local ICWA at that point would be Arizona, which, as I mentioned, has this memorandum of understanding but not a law, Utah, and then Montana. So it's definitely something that I heard a lot in sort of the discussions after the Brackeen arguments was generally a sense that the tenor of the questions from the justices and the arguments made people feel more optimistic, I think, that ICWA would not be entirely struck down, but still could be gutted in certain ways or have significant provisions struck down. And that one of the sort of ground game strategies for people that are supporters of ICWA for this year, and especially after the decision comes down, especially if it's not favorable, would be to push for more state level ICWA laws. Now, I kind of describe these in the context of how many federally recognized tribes are within these states that have the state laws. When you look at it that way, it is certainly good to see, if you're a supporter of ICWA, that state laws cover this 86% of those tribes. But I wouldn't say that that's the entire breadth of coverage, certainly of ICWA. There are certainly high Native American populations in states that do not have a lot of federally recognized tribes, and ICWA does not apply only to governance of child welfare on a tribal reservation or tribal lands. So we'll see if those three states move or if we have any legislation come into the hopper from some of these other states. Let's take a quick break and we'll come back with some more headlines.
Are you a professional in the field of child welfare, juvenile justice, or other family and youth services? Subscribe today to Youth Services Insider, the imprint's exclusive section on all the insider news you need to stay in the know. Funding opportunities, major federal and state policy shifts, interviews with key leaders in the field. It's all available only for our Youth Services Insider subscribers. Sign up for a monthly or yearly subscription today by visiting imprintnews.org/subscribe. Our podcast listeners get 10% off their subscription by entering the promo code PODCAST10. That's imprintnews.org/subscribe and get 10% off your subscription by entering the promo code PODCAST10 today.
All right, let's get back to some more headlines for this week. And this first piece is a little bit more of a analysis of many headlines. So in the past few years, we have seen some of the longest running class action lawsuits in child welfare come to an end. Tennessee, Connecticut, New Jersey, Washington State, and Washington, D.C. have all exited or are very close to exiting, huge consent decree settlements that stemmed from class action lawsuits that were filed decades ago in a lot of these cases, particularly Connecticut and New Jersey. Those were decades ago. But a fresh round of litigation has cropped up against different systems, and they have a common theme: mental health services, either the kind meant to help prevent the need for foster care and system involvement, or the services for youth once they are in. I'll drop links to our coverage on this, but here are just some of the states where we've seen lawsuits filed recently: Alabama, Alaska, New Hampshire, New York, and Washington State. And then just in the past 2 weeks, you can add two more to that list in Iowa and Maryland. So in Iowa, the allegation is that the state has a lack of accessible community-based mental health care options, quote, despite receiving substantial federal Medicaid funding for that very purpose. And then in Maryland, the focus is on the use of psychotropic drugs on foster youth. A top-line assertion in that filing is that about a third of foster youth in the state of Maryland are on a psychotropic drug, and of that group, that third who are on them, 75% have no diagnosis attached to the use of psychotropics. Now, I will say, when I first read that, what jumped out to me is that one reason that you would prescribe a psychotropic medication, I'm saying this is the driving reason, or it was the one that jumped out to me, would be to keep a youth subdued or sleepy, tame with drugs. And that's the most likely drugs for that would be, frankly, the strongest of the psychotropic drugs, the antipsychotic class, that are really, mind-bending drugs. That's the term that I remember Senator Tom Carper using when the Democrats on the Senate Finance Committee were threatening at one point to get really serious and play offense, I think was the quote they used, on regulating psych meds for foster youth, which I would not say has been a success around the country just yet. So there's really three kind of distinct avenues that these mental health litigations are going in. First is the quality of treatment facilities that certainly has been the focal point in, for example, Alabama and North Carolina, where psychiatric residential treatment facilities, or PRTFs, are really supposed to be sort of the gold standard for secure, highly medical, trauma-informed interventions for kids who need, the secure setting of a residential facility. And in both states, the litigation has called those out into question about their efficacy and their safety. The second avenue would be this lack of community options to prevent the need for foster care or for residential use of any kind. And then there's the use of psychiatric medications, which came up, as I just mentioned, in Maryland, but then also in a recent case that's already been settled in Missouri. The common thread of all three of those paths, in my humble opinion, is Medicaid. I think we might be seeing, as a litigation strategy, a push here to take the gap between what's on paper with Medicaid and what the reality is, and then kind of pushing that in court. Because if you think back to what I had just referred to in Iowa, the litigation is asserting that there's a lack of community-based options, despite the state getting a lot of money from Medicaid to provide them. The psychiatric residential treatment facilities that are, in question in North Carolina and in Alabama, that is one of the few residential options where a state can bill Medicaid for the services. And then, of course, it's long been kind of asserted and known that, the gap, the disparate, use of psychotropic medication on foster youth versus the general population of youth is in part driven by the fact that Medicaid will pay for much of the medication that goes to foster youth, because every foster youth is eligible for Medicaid, and that is not the case with most children around the country, or at least a huge percentage of them. So this is, when I say the litigation strategy, it's more just maybe a collective realization or push towards, you are agreeing when you take a split with the federal government on Medicaid to provide certain things, you're putting those on paper, and the assertion in this litigation is you're abusing, in some ways, overusing, medication, but also at the same time not putting together the level of, community-based options or the quality and efficacy of residential care that you would guarantee by, splitting the cost with the federal Medicaid program. In addition to this current spate of litigation, I wanted to discuss something of a common thread that ran through a few news stories from this summer. I kind of had this down to talk about on the podcast and never really had time. But to boil it down to one sentence or question, I would put it under the headline of, could we be seeing congregate care or residential care move upstream? So follow me on this. I'll preface it by saying it's a little bit of a tea leaf reading situation, and I'd love input from listeners, tips at imprintnews.org, even if it's to say you're an idiot. But here's just a few data points, if you will, that sort of raise this question to me. So in June, there was kind of a slate of coverage, mostly out of New York, that really got me thinking about this. ProPublica and the city partnered up on a story about the subject, and it led with a mother trying to get her very sick daughter help, landed on wait lists for both community and for residential options. But I would stress that at some point, the mother really did come to the conclusion that her child was not safe living in the home and did need some sort of residential help. So I'm just going to read from the story here. In the past 10 years, more than half of New York's residential treatment facility beds for kids have shut down, with the total bed count plummeting from 554 in 2012 to just 274 this year. Sick kids often wait months to get into the remaining beds, despite a 2005 federal court settlement in which the state agreed to cut wait lists and make admissions faster. State officials who license and regulate residential treatment facilities have done little to fix the problems, an investigation by ProPublica and the city found. Instead, the officials have made bed shortages worse, green-lighting facility closures, even as the number of kids in psychiatric crises soared. In recent years, the state also made the admission system even more complex, keeping sick kids in limbo while they wait for care. Now, later in June, same outlets following that reporting with some React stories about that. I'm just going to read again from one of those. By slashing inpatient psychiatric care, New York has left people with too few places to turn for treatment of serious mental health conditions, State Attorney General Letitia James said at a hearing held by her office Wednesday. That Wednesday was in June. James called the hearing following reports by the city and ProPublica on New York State's failure to provide mental health care to children and adolescents. Now, also from June, just happened to be, I guess, a busy month on the adolescent mental health front in New York, the New York Times published a piece on a child named Sabrina Benedict and her parents. Sabrina, who's very large for her age, exhibits aggressive behavior that stems from autism and a genetic disorder. So allow me to just read a brief snippet from that story. The state's answers to these families is to provide more support in the home. The Benedicts, like many people in a similar situation, were given a case manager and a budget to hire a home aide for their child, but a single aide is often unable to handle an aggressive teenager. But if home life is untenable, where should Sabrina live? In New York State, there are around 50 residential schools, mostly private and expensive, that specialize in working with children with disabilities ranging from autism to traumatic brain injuries. But the demand for the spots is great, and these institutions are generally able to pick and choose whom to accept. Each year, to meet this need, New York will pay, often grudgingly, for around 300 children with disabilities to attend out-of-state programs. Autistic children make up the largest share. And I'm going to tack one more thing onto this list. Bear with me here, and this is from a few years back. In 2020, we had on this podcast Ohio Medicaid Director Maureen Corcoran to talk about her state's pursuit of a waiver that would allow them to rethink child and young adult mental health, with one driver towards that waiver being that they conceded parents were being fiscally driven to surrender their kids to foster care just to keep them safe from behavioral health crises. That is not an assertion I made. That is something that they were forthcoming and basically said caused them to need a different path on how they were using both their federal and state resources on mental health. So tying all this back to child welfare and frankly to youth justice as well, the thread here are parents who felt to some extent that their children needed to live in a residential care setting for their safety, for the child's safety, and run into two big barriers: a lack of supply and prohibitive costs. The two payers who have long had success accessing behavioral health beds for youth are child welfare systems and youth justice systems and rich people. But the serious problems with safety and efficacy in many group care programs has been behind, this growing campaign to curb the use of group settings in foster care. And that has worked. There were dozens of states that had 20% or more of their foster youth in congregate care, as recently as the early 2000s. Now that's down to just, I think, 2 states that have 20% or more of their kids in foster care. And there are some states that have gone from that realm of having, 1 in 5 foster youth living in congregate care down to, less than 5%. In 2018, there was a federal law called the Family First Prevention Services Act. We've talked about it quite a few times on this podcast, that further put constraints on federal funding for congregate care for foster youth, and at the same time increased federal funds available to approved models of child behavioral health aimed at preventing the need for foster care. So it actually opened up services well beyond child and adolescent behavioral health models, but that is one of the things that the clearinghouse for that law has approved, quite a different set of models for. So there's this one open question, I think, when it comes to the Family First Act and what it did, because the presumption on preventing foster care, I think, is reasonably that those services would transpire at home or in a community. But it doesn't actually say that prevention services could not be provided within the context of residential care centers. So in 2018, I asked officials back then, different administration, at the Administration on Children and Families, so this is during the Trump years when the law became enacted, in regard to the front-end services permitted by the clearinghouse as part of Family First, is it allowable for those services to be rendered in a residential care setting as opposed to in the home or through some sort of outpatient program? So in other words, if the imminent risk of foster care entry is brought about by behavioral issues that a child experiencing and the parents' inability or struggle to keep them safe, can the allowable services to prevent foster care be administered by a residential care provider if that's deemed the best strategy, not as foster care, but as a preventative mental health intervention. This is in 2018, so I'll preface this by saying perhaps this administration would have a different answer. But what I received back was that the administration had not issued official guidance on this topic. In such circumstances, the Children's Bureau encourages states to work directly with their Children's Bureau regional offices, as the specifics of how state plans are developed can often determine whether something is allowable under the statute. So I would say that that is sort of federal legalese for saying we did not want to answer that and are likely going to defer to what states want to do with this money to prevent the use of foster care. So we have seen a strong, sustained push to get foster care largely out of congregate care use. Some would say that's gone too far and we're now short of capacity that the system needs. Others are pushing for an end to its use entirely or almost entirely. What these stories and these developments that I was highlighting here show to me is a desire for more parents to be empowered in seeking residential solutions themselves for their children's safety, which I think is an interesting conundrum or at least paradigm here, in that we wouldn't be talking about different places. It would be the same residential care places that serve foster youth who would house a child sent by a parent. Now, rich people might get their own wilderness camp or really high-priced options for residential treatment. That would not be the case for a lower or middle-class earning family who were at their wits' end, who really felt like they or their other kids or their child or all three were in danger with a child living in the home and that they would need help in a more protected setting. So it creates a situation where child welfare agencies are criticized for their use of congregate care, but parents perhaps are more supported in their push for more access to it, despite the fact that the actual environment we're talking about is the exact same one. Now, how Family First ties into this is that surely the cost of the residential part of foster care prevention is not going to be split with the feds through 4E, which is the child welfare entitlement. So states would be on the hook, I would think, for paying for the sheltering of the youth in residential care. But it is possible, it seems to me, based on the kind of non-answer from the feds back in 2018, that the treatments in residential care for youth who aren't foster youth would or could be payable via, the new permissions and new clearances brought about by Family First. We'll wrap up this week with some recommendations for a few recent reads and resources for listeners. First is the Imprint's recent story on the mounting pile of evidence that clearly ties cash benefits ranging from food stamps to guaranteed income to less reports of maltreatment and to some extent less substantiated maltreatment as well. Reporter Amanda Abrams did a really great job taking readers through the many recent studies that have drawn this connection, which obviously backs up the widely shared concern that some significant amount of child neglect is just poverty being misconstrued or misinterpreted, which, to bring us back to the original headline or one of the original headlines from this episode, the Biden administration is seeking a partner to kind of help states to parse that and differentiate neglect in particular from poverty situations. And this all connects also, as well to the conversation around a more generous child tax credit like the one that was included in the American Rescue Plan. Second story I wanted to recommend was Jolie McCullough's story in the Texas Tribune about Finish the Five, which is a youth-led campaign to shut down Texas's 5 currently existing youth prisons in the state. So I think we've brought this up over the summer on the podcast. These facilities have particularly struggled during the workforce crisis of late. They don't have enough people to keep kids safe working there. So what's happened instead is that kids have been confined to their rooms. A lot of them have been put on suicide watch. They're forced to go to the bathroom in water bottles, things like that, because there just simply are not enough staff to keep youth safe. But that is a current problem. The youth prisons in Texas have long had a dark history, including, the feds coming in and taking some oversight over them in the 2000s because of some reported sexual and physical abuse within the prisons. So these young people are leading the charge to close all these. It's kind of worth noting that the only state with a bigger youth justice system than Texas is California, and that was a decades-long push that just ended in that exact way. California's youth correction system used to house something like 10,000 kids. Over time, that number dwindled. The number of youth prisons dwindled to where it was under 1,000. And now the youth prisons in California will be sunsetted, I believe, by the end of this year. They've stopped taking new admissions into them from counties. So California's youth justice, as far as incarceration goes, is handled now entirely by counties. And that's, presumably what this advocacy campaign is seeking to accomplish, is to get the state and its problematic youth prisons out of the way and to have the system be much more local. One thing that didn't come up in the story that I think has to be a factor as, legislators hopefully take this seriously, is that Texas is one of 3 states left that has not raised the age of the juvenile justice system to 18. So in Texas, Georgia, and Wisconsin, all 17-year-olds are considered adults in the eyes of the law for crimes that they commit. They are treated in the adult system, even though they are minors. And over the course of the last decade or so, most states that have been in that position, which included Connecticut and New York, North Carolina, Michigan, many other states, have raised their age so that 18 is the threshold. Now, it seemed like the smart move, if you were going to eventually get to where you're dramatically changing the sort of outlay and structure of the juvenile justice system in Texas, that you would want to do that at the same time as you raise the age, as opposed to realigning the entire system, a system that only included youth up to 16, and then have to figure out, okay, in this new outlay of what we're doing in community options and incarceration facilities, how do we, when the age does get raised, because I do think eventually all 3 of these states will raise their age, how do we now, crowbar in a whole set of older teenagers into that? All right, and we're going to just wrap up with 2 recommendations on some pretty good references that have come out of late in the space of youth justice. We talked to Melissa Sickmond of the National Center on Juvenile Justice a few weeks back on the podcast. Her outfit there, NCJJ, has put out a tremendously helpful reference for anybody that, in their activism or advocacy or just their general knowledge needs to kind of have like a quick reference to anything juvenile justice or youth justice related. The Youth and the Juvenile Justice System 2022 National Report is your guy. It's a couple hundred pages long. You're going to have information about youth population all the way to youth victimization, offending data, all the facts you need state by state on how different juvenile justice systems are structured and work, and much more about sort of 10-year trends and longer term patterns in, both law enforcement and the behavior and processes in juvenile court. So I will drop a link, of course, to that report for you in the show notes if you want to get it. The other one that I wanted to highlight is called Why Youth Incarceration Fails, an updated view of the evidence. This was written by Dick Mandel for the Sentencing Project, and it sort of parses this topic into 3 buckets. Part 1 really focuses on evidence that youth incarceration is suboptimal or even producing negative outcomes. Part 2 seeks to sort of put together the available evidence for why, analyses around why that is the case. And then part 3 gets to different approaches to youth justice that do not involve incarceration. Just sort of list some of the major national brands, so to speak. Youth advocate programs, YAP, which operates all over the country. Youth Build highlights some other ones as well as some local initiatives. I think the intro paragraph that jumped out to me was, this assessment finds that the sizable drop in juvenile facility populations since 2000 is due largely to a substantial decline in youth arrests nationwide, not to any shift towards other approaches by juvenile courts or corrections agencies once youth enter the justice system. So that's significant for two reasons. As we talked with Melissa about on the podcast a couple of weeks ago, the number of youth who are arrested in this country has plummeted over the last several decades, and in particular since COVID really went down an incredible amount. And at the same time, as Mendel points out here, the number of youth who are incarcerated has declined at an equally great pace. What he is saying here in this paragraph is that it's a causal situation without a lot of, peripheral factors driving it. And that's significant because there certainly have been lots of efforts to change policy. There have certainly been a lot of efforts to change the way that courts operate and shift things. So, it's sort of an assertion kind of buried in this intro that, none of that really seems to have had an impact, and that really the only reason we've seen a lower use of incarceration is because the denominator dropped. There just are less kids who are arrested, and thus there are less kids who could possibly be incarcerated, because you can't really be incarcerated if you were not arrested in the first place. So like with the other one, I will drop a link to this into the show notes for anybody who wants to dive in there and get a read on what Mendel has presented. All right, that is going to do it for this week. The Imprint Weekly Podcast is a production of Fostering Media Connections, a California-based nonprofit that publishes the Imprint, Fostering Families Today, and operates the Youth Voices Rising program. This podcast is produced and mixed by Christine Anjoko, with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we'd love it if you consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we would greatly appreciate if you consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is super easy. Just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews, and visit us on the web at imprintnews.org. And you can always reach us over email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.